The purpose of executing an in-home urine drug screen is to detect either the presence or absence of metabolites of these drugs in the system. What that means is, regardless of the way a person would take an illegal drug into their body, the body is going to process it and break it down much like it would a prescribed medication or any other chemical. And that means that some residue or residual of that product is going to be left in the urine once it is metabolized, hence the term metabolite. So this test is designed to pinpoint any metabolites of these specific drugs and to produce a visual result on the test agent once the urine's been tested and the metabolites been screened. It's a complicated process in terms of a laboratory function, but it's just looking for a byproduct of a drug and using that presence of byproduct to determine what the test result is going to produce. It's similar to a pregnancy test, except the pregnancy test is going to test for a particular hormone. It's the same concept, but a different body chemical.